The National Centre for Creative Health, like many organisations in the room, lobbied very hard to try and get creative health into the 10-year plan. Did we succeed? No, that was disappointing. But are there opportunities within the 10-year plan for promoting creative health? And the answer is definitely yes, and definitely the conversations around neighbourhoods is, I think, the way to do that. What do I think the NHS needs to do, and the department needs to do, in order to encourage creative health? And I think there's three things. So the first thing is the centre of the NHS needs to better understand what neighbourhoods are. And they don't understand that at all at the moment, it has to be said. When you're sitting in Whitehall, it does look like anything below Whitehall is a neighbourhood, it's a locality. And of course it isn't. Neighbourhoods are what happens in small communities within towns and cities, what happens in villages, in parishes, what happens sometimes in streets. That's what a neighbourhood is. And neighbourhoods are where energy grows, where energy is established. The department really needs to understand the role of neighbourhoods in creating a sense of identity, a sense of common purpose, a sense of pride and trust. And on the basis of all of those is where activities around creative health actually happen. And what we need is a true devolution of power and resources that go with it in order to create a real energy around creative health. I think that shift into understanding that people engage with their health when they feel that a sense of ownership, a sense of pride, I guess a greater understanding of themselves, all of which are generated through creative health activities. There seems to be a slightly strange belief that creative health practitioners, unlike health professionals, don't need to pay their mortgages and don't need to pay for their food bills. They do. So we need to invest in creating a proper infrastructure and workforce in creative health in order to deliver this. Getting contracts in the right place, neighbourhood contracts they talk about in the 10-year plan, very exciting to do that. Getting the KPIs in the right place, and then government needs to step back and let the neighbourhoods grow from the bottom up, because that's where change will happen. Thank you, Simon.